Hey guys, Denise here, and welcome to my presentation on Is the Scene Safe? This is going to be a simple guide for first aiders who respond to an emergency. Now, if you're here for the first time, welcome. And what I'd like you to do is hit that subscribe button and don't forget to hit the notifications button as well, so you're not going to miss another video as bad as this. Bad meaning good, right? All right, guys, so this video today is going to be just focusing on the safety of and why it's so important to focus on the safety when it comes to responding to an emergency. It's going to be something that is well worth the watch. So I am telling you, you need to watch until the end. It's going to make a difference in how you do your responding or your response of helping anybody in an emergency. All right, so let's get this thing started. All right, so let's look at what an emergency is to make sure that we have this clear understanding of what an emergency is. It's important we go through these steps. So an emergency is a situation that poses an immediate risk to health, to life, property, and environment. But we are in EMS. We are part of the emergency medical services as the first aid provider. And in EMS, an emergency is going to be focused on the immediate risk to the person, to the life of the person. And it's characterized by a sudden illness or sudden injury. Sudden illnesses would definitely be more of a medical type emergency, and sudden injuries is going to be more of a traumatic type injury. So an emergency it can happen anywhere, anytime, and it definitely can happen to anyone. So what is a first aid provider? And a first aid provider is someone who's going to be trained to do a few key points or key things. And it's going to be someone who's trained to recognize, to assess, and prioritize the need for first aid. Provide first aid care and know their limitations, and also they're going to know when to seek further medical assistance. So a first aid provider is usually going to be the one who will be making that call to request further help from ambulance service, especially if it's at home or at work. Persons who are trained, that is one of the main points that we want to um, make sure that we understand. It's not just about somebody making a call, but a first aider has to be trained and to understand to be applying first aid in the first place. So you recognize that there is an emergency that took place. Two things we want to take into consideration when we recognize an emergency take place, right? Two things going to be, is that person sick or not, or if how the injury happened to them. So we usually call that the mechanism of injury, meaning that did they fall down the stairs, did they get stabbed, those different things. Where trauma is sustained on the body, it's called a mechanism or a way of how the trauma was sustained. So we can look at two mechanisms of how the patient was injured or if the person appears to be sick or not, right? Once we have determined which it is, we can make a more informed decision as to if we can help. Helpful hints to determine the emergencies is going to be the location where it's happening, the position of the body, or the patient, I should say, their body position. They're conscious or they're not conscious. Is the scene safe? And that is what we want to focus on today. Those things that make you decide if you're going to enter into that scene is going to be determined by the safety of the scene and if it's going to be dangerous for you to get in there. All right, let's go. All right, so the scenario that you're seeing, that picture you're looking at, that person, those people there in that flooded area, those people you know real good, as your boy, as your girl, they need help, but you are on the other side of that flooded area. Is the scene safe for you to go in there? I mean, those are the people that you really want to help. We could make really bad decisions when it comes to our loved ones or close friends, relatives, and we could end up being worse off than them, and even it could lead to fatality. So once we recognize that there is an emergency, we need to take a pause, and we can use this setup acronym to help us before we go forward into the scene. Setup stands for surroundings, environment, traffic, unknown hazards, and your personal protection. All these are really good points to look at and think about before you run into helping that person into that scenario. So what do we mean by looking at our surroundings? And it's something I think that we really don't take into consideration. Persons who are not trained, they run into an environment or a scene that it's probably is very dangerous, and all they're saying is, I need to help this person. And what happens is you become a part of the situation, and you could also become hurt or in a place where, you know, the person is actually better off than you were before you decided to help. So your surroundings is important to look at before you get into that scene. When you recognize an emergency has taken place, you decided to help, your surroundings is going to give you further information about what you're doing next. What you want to do is look at suggestive things I'm going to talk about here. Are there any riots involved? Weapons? You seen any weapons? Any illegal drug paraphernalia lying around? That could be an indication that the person or whoever it is that is in need of help, maybe they, you know, are not able to be contained, or they need restrictions, and you are going into a scene that may be quite aggressive. Do you hear any aggressive shouts towards you while you're going into the scene? Is there excessive blood on the floor or things that you may not take into consideration and you're going into that scene? Make sure that you are checking your surroundings. Make sure that you're comfortable with what you see before you move on. When we're looking at the environment, we definitely should be thinking about outside. The environment and surroundings is going to be two different things. Your environment should direct you to what is happening to you externally or outside. You're going to be looking out for storms, floods, fires, landslides, falling debris, lightning. Those are the type of things you should think about when you're checking out what your environment is like, if it's safe to go forward. This would definitely direct you to your next step. Right, so we also looking at traffic, and traffic is something that I don't think we are very mindful when it comes to seeing a motor vehicle accident on the road, and we just stop in anywhere to run to try to help the people in the accident. Um, Especially if it's somebody you know, it's a car you know, and you realize that that's your friend or your family member. I mean, I think it was one time I heard that somebody actually got knocked down who was parked and running back because they didn't park, or they didn't check where they parked, and there was oncoming traffic. So when dealing with motor vehicle accidents, it's important to take your safety into consideration before going into the scene, as I was saying before. Things to consider is going to be where the vehicle is located, the one that you're going to help, or the persons in the vehicle, where they're located. Where you park your vehicle is very important. How far you should park, because it's important to understand that when you park your vehicle, there's going to be fire, there's going to be police that needs to come there, even the ambulance services. And if your park that is blocking their ability to get close to the wreckage, that is something that will actually delay further help to the persons. And you don't want to have that be the cause of why the patients aren't getting further help. You know what I mean? So make sure that you know where you're parking and give room for the emergency vehicles to come in. if the accident is located on the highway, on the other side of the highway, and if the police are on scene as yet. Because if the police are on scene, then you should know that you need to follow certain directions and not try to just let your emotions take over and don't listen to the police because they're here to help. So now we're going on to the unknown hazards, and that exactly by the name of it, it's unknown. So it's not something that you can visually see, but it's something that you may have to use um, a little intuition or try to pause for a little bit longer and really look at the scene to make sure that you're not going to be trapped into something that you didn't foresee, right? Or you didn't because you couldn't see it. So unknown hazards can be quite surprising when you're already on the scene of an emergency. You don't want that to be you. It is best to pause and look at what you see with a general impression of the scenario at hand. Unknown hazards could look like electrical wires that are still live on the floor or in the ceiling, um, reaching into a bag and getting pricked with a used needle, or the smell of gas or the chemicals, etc. Do not bypass that. Those are going to be your unknown hazards. And it's important that you are aware that they can have these things and, not rush into the scene. If the scene is not safe, get out. All right, so the final piece that is going to be for you to make sure that you're going into that scene and it's safe is your personal protection. When helping in an emergency, there is a risk to expose yourself to blood and other infectious body fluids, and such as HIV/AIDS, hepatitis B and C. You also have vomit, saliva, and I wouldn't go to name the rest of it, but you get the idea. Personal protection takes the form of gloves, face masks, gowns, or goggles. And it's really important because as I do more and more first aid classes, and I guess just teaching on the whole, you always hear persons talk about, oh, if that's your family member, if anybody just running in there, and I don't care if I have gloves on, because you want to do whatever it takes to get them safe and render assistance. You are taking a big risk by doing that, but it's your risk. So if you're okay with that, go right ahead. But ask yourself if it's really worth it to put yourself or expose yourself to something like that, especially if somebody is bleeding out and there's no protection. It's too much things happening now out there with what we can get and what we're exposed to. So I highly recommend that you keep your gloves close to you in your pocket or in your bag or in your glove compartment, that it's easy to get, that you wouldn't have to make those choices, those difficult choices. Also make sure that to check the gloves for holes before you put it on, and don't just like push it onto your hand quickly because it could actually rip. Make sure it's the right size. Those things are important as well. So the scene safety is really your safety, and that's why the setup, going through the surroundings, the environment, the traffic, unknown hazards, it's all part of making sure that you are safe at the end of the day. Putting yourself in danger will make the situation worse, remember that. So a little guideline that you can use is always make sure and pause. Do not rush in. It's not worth it. Look for hazards and protection, potential dangers in your surroundings, in your environment, the traffic that we spoke about earlier, and also make sure that you have your personal protection. If you keep that in mind all the time and do not panic when an emergency is in front of you, you will actually be doing much better job. You'll feel comfortable, and the persons who you're assisting, they're going to feel even better, or safer, I should say, in your hands. Remember, if it's not safe to do so, do not go into the scene. And if you're in the scene and it becomes unsafe, make sure to get out. And that is about it. We are finished. It is completed. It wasn't too bad. And I'm sure you may have some questions. If you do, you can leave the questions or the comments below. What do you think about this presentation? Is it something that you learned from? Is anything that stood out to you? Maybe you were in a scenario of a last emergency and maybe you realized you did something off. How did it affect you? How did this information that you just received? If you want, guys, leave me a comment below. And if you'd like to become trained to be a first aid provider, you can email me at lifecyclett@gmail.com. You can visit our website, lifecycle360tt.com, for more of what we do, because we do different types of first aid programs there. And it was nice, and I must say thank you for staying with me and learning a little bit more on how you can be better prepared and understanding why it's so important for your scene to be safe. Take care, guys, and I shall see you next time. All right, bye.